Welcome back to Facebook Live. I'm Chris Stauffer, and we're here to talk about chiropractic care. Chiropractor Dr. Josh Potaracke is joining us to talk about that. I think one of the fun things that we were talking about before we started this is what is chiropractic care? You said, well, if you ask 10 different chiropractors what that means, you're going to get 10 different answers. But in your mind, what is chiropractic care?
Well, there's going to be some variance in the definition of it based on individual practitioners' sort of personal experiences with chiropractic. But really, the fundamental things is it surrounds structure and its relationship to function. So structure primarily for us chiropractors in the spine, and then function as it is primarily coordinated by the nervous system.
Okay, all right. What would others say?
Well, then as you extrapolate beyond just those simple things, our primary tool is spinal manipulation. There's a lot of dietary recommendations, soft tissue treatments, exercises that we all recommend for our patients as well.
I think one of the things at Gunderson is that you're really looking at integrating the spine care and sort of a more broad approach to taking a look at back pain.
Yeah, so most of what we see here at Gunderson is back, neck pain, headaches, that sort of thing, and we're integrated with the physical medicine department. So within our team, there are medical providers, PAs, nurse practitioners, and we also then coordinate a lot of care with our physical therapists. We're on the same floor as neurosurgery, pain medicine, so a lot of resources, and a multidisciplinary approach is often what some of our more complex patients require. So.
All right. What is it usually that causes back pain? What's that first thing that people come in and they say? I think a lot of times the first step is to go see a chiropractor because they don't want to go to the doctor. They want to just do a simple fix, and that's why a lot of times they're turning to a chiropractor.
Yeah, so chiropractors, we're a great portal of entry into the back care sort of pathway. Where our access is typically very good. We're relatively low cost comparatively to other treatments. Really what happens is a patient then can come to us. We can assess them, whether it's chiropractic related or if we need to filter them on to other providers. But there's a lot of collaboration that happens.
Probably a few shoveling injuries.
Well, I was going to say shoveling has been part of it that we've seen a lot of. It falls. Actually, now with the recent
ice,
weather, and it'll transition to gardening soon. So there's always a lot of things that keep people coming into our office, but it depends. A lot of it has to do, there's traumatic injuries. Some of our patients, as they get up there in age, have some degenerative changes that we can help address. So there's different treatments, different approaches that we can take for the different patients that we have come in.
We're talking with Dr. Josh Potaracke about chiropractic care. Who should see a chiropractor? Who should be the first person that, comes walking in the door?
Well, and I think we'll get into some back pain guidelines later in our chat, but really the patients that we want to see are the patients that have tried some self-management. So they've tried heating, icing, a lot of those more basic self-management type tools that a lot of us know.
Sure.
Staying active is one of the big things. But if they've tried that for a few weeks and they can tolerate the discomfort as they go through some of those things, then it's probably appropriate to come in, see us, have them worked up, and then see if we're going to be a solution to their problems or if we need to get other people involved with their care.
So let's dive into those guidelines. What are those guidelines for seeing a chiropractor?
Sure. So for acute, subacute pain, so anywhere between the 4-week range and then getting into the 12-week range, the recommendations are typically the same. You want to be as conservative as possible. And so what we really look at is more that self-management. Most back pain will get better on its own if you, one of two things. One, can tolerate the pain while it gets better. Number two, have an environment to allow it to get better. Most of us, unfortunately, are out shoveling snow. Me, little kids that I'm chasing around. So sometimes that opportunity to get things better isn't always as easy to come by as we'd like it to be. But with chiropractic care, oftentimes our role is just to expedite improvement where otherwise it might be slower going.
All right. Let's talk a little bit about some of the myths that you hear about chiropractic care.
Sure.
I'm going to let you, open up and, what are some of those myths?
So one of the common things that we hear is once you see a chiropractor once, you need to see them all the time forever. And that's not really the case. Here at Gunderson, we do have a pain management sort of focus. So we see patients that perhaps are in a lot of trouble with pain, and our goal is to become as useless to them as quickly as possible. We want them back to functioning well. So we monitor their pain, but more importantly, we monitor their function, because that's what patients come to see us for. And so we try and really treat them as quickly and as efficiently as we can, and then send them on their way, hopefully with some good exercises and healthier lifestyle habits.
Yeah, those exercises, I know a lot of times people don't necessarily follow through on those, and that's an issue, because sometimes the back pain will recur, and then they have to come back and see Dr. Josh.
It is. There's that sort of cyclic treatment path that a lot of patients take, and here at Gunderson, we have a great team of physical therapists that we can involve in their care, and they do a great job of not just giving them things to do, but stressing the importance and the why it's important for them to do. And a lot of patients that come in, we'll tell them we can get you better, but really it's up to you to keep yourself better. So if you keep seeing us, it's typically not because you're not getting the treatment that you need. Typically there's some things at home or just lifestyle related that could be changed to prevent that.
Let's talk about a little bit of prevention. What are the things that people should maybe avoiding so that they don't have to come in for back treatment?
So generally conditioning is very important. So exercise, healthy weight. We see that smokers tend to have a little bit more incidence of back pain and slower recovery. So smoking is another issue that we see, but of course a lot of us being in front of computers, it takes a toll. A lot of back pain can be prevented just by staying more active in general.
All right, good advice. Dr. Josh Potaracke, chiropractic care. If you want to learn more, you can go to the Gunderson Health System website. And speaking of the website, there is actually a self-help tool on that. Can you explain what that is?
There is. So one of our physical medicine physicians and one of our physical therapists developed this website, and so it's a risk assessment tool. So you can go onto the Gunderson website. I believe we'll put a link up that you'll be able to kind of take a look at it, and it really analyzes where you are in your sort of back pain journey. So whether we're going to continue to recommend a self-management, which is often the case initially, it will outline a plan for you, and it'll go through different phases of care as you go through approximately 4 to 6 weeks. It'll give you exercises that's been demonstrated by one of our great physical therapists, and so you really have a interactive sort of tool. You can put it on your smartphone, and it gives you exercises. The majority of symptoms, like we've talked about before, just with time will be addressed and get better, and then those are the ones when they don't get better that we want to see coming into our department.
It doesn't cost you anything to log
doesn't
on.
cost you anything, and really that's the great thing about just this organization in general at Gunderson. We're very focused on community-based sort of preventative care, and if we can keep patients from needing us, obviously it's a lot more cost-effective for them, and really, bottom line, they do well. If you're exercising and getting things stronger, you're going to be more resilient and less susceptible to future injuries as well.
One other myth that I did want to ask you about: pregnant women, children, can they have?
Yeah, all can
care?
benefit from chiropractic care, depending on issues that may be occurring. But a good evaluation by a chiropractor can help determine if chiropractic care is going to be the right form of treatment for them.
I know one of the things that people will talk about all the time is that emphasis on the spine and keeping that spine aligned, and that's one thing that you're helping to guide. But as you said, integrating that with the Gunderson team is a huge resource that is available to the community.
Yeah, and it's a unique resource. We get facilities really across the country that have inquired about how we've been implemented kind of as a frontline treatment, and really to prevent patients needing to get more complex type care or more typical care where they may require injections and things like that. Oftentimes we can, hold them before they get to that point where they need those things, and patients do well with it. Of course, some need that care, and it's great that we have great providers here that are able to offer that.
All right. Again, chiropractic care, it's offered at Gunderson Health System. You can learn more by going to the Gunderson Health System website. That's going to wrap it up for us, but certainly if you have any questions, you can certainly you can put those down right now, and we'll try and get Dr. Josh Potaracke to answer them as we go through. So thanks for joining us on this edition of Facebook Live.